Hello everybody, and we're back to the Life Lessons Laugh Sessions YouTube channel, and today I want to talk about something very important, and that is being annoying. I'm kidding. It's about patient advocacy, and I say annoying because when you advocate for yourself as a patient, sometimes people say that you're annoying, and right now, first and foremost, I'm going to tell you that those people are flat out wrong. So here we go. Time to talk about patient advocacy because it is very, very important, and they don't teach a class for this. And when you become chronically ill or your illness gets worse, like in my case, you don't get a playbook for how to deal with your illness or what to do or how to act with doctors or what to say with doctors, and it's a whole mess. So I just want to talk about it because it's very important, and I know that I've struggled with it, so I'm sure that other patients have struggled with it because, like I said, there's no rule book. So here we go. Number one, come prepared. Always come prepared to your appointments. If it's a list on your phone, a list in paper form, questions that either you have or if you have an appointment buddy, like I always do. My mom always comes to my appointments with me because half the time brain fog is too real. And she also likes to be aware of what's going on with my treatment plan just because it's always so extensive and there's always so much information that she can take notes and I can just digest the information, and then because she's taken the notes, I can look back on them later. So when you come prepared, things don't get forgotten or missed. And when you come prepared with a list of your questions or a list of your concerns, the appointment has a way of unrolling in a way that is somewhat organized, and your questions get answered rather than just all this information thrown at you and you still leave the appointment feeling insanely confused. So always come prepared with a list for your questions to get answered and then to take notes if other information comes at you and you want to look into it later or just flat out remember it. So come prepared. Being nerdy works. Number two, don't be afraid to switch doctors. Now, I know this is difficult and this is scary territory because finding a doctor is hard enough in the first place, and it can be really difficult when you've found a doctor and you're getting treatment but you don't feel like you're getting the best treatment you can get, to weigh the risks of switching to a new doctor. Is it going to make things worse? Is it going to make it better? Or staying where you're at when you know you're not getting treated the best that you can be treated. So it's weighing the pros and cons, and also waiting lists and how long it's going to take to get treated, and if they're going to know your treatment plan, if they're specialized in your area of concern, like your current doctor, if they are. So there's a lot of things that you want to look at beforehand, but if you don't feel like you're getting the best treatment possible that you should be getting, don't be afraid to explore other options. Don't be afraid to look for other medical professionals because there's more than one in your field of concern, okay? So don't be afraid. It's not their feelings that you have to care about. Your treatment and your body. So if you want to switch, do your homework, but don't feel guilty about it. It's fine. They'll get over it. Number three, ask questions. I probably annoy the crap out of my doctors for how many questions I ask. And you know what? That's fine. That's literally their job. Their job is to care for you as a patient, and if you have questions, ask them. If you're concerned about something, raise that concern. You want to get treated to the best of their abilities, but also to your level of comfort so that you're not freaking out, worried all the time about what the heck they're doing, or you don't understand what they're doing and you have questions. So be an informed patient. I really go way overboard with research for my treatments and potential treatments and doctors and plans and protocols and all that stuff, but that's just me. But don't be afraid to ask questions about your own treatment or other avenues that you've looked at that you have questions about, because maybe you've thought of something that they haven't thought of, or your question triggers something that could be added to your treatment or tweaked or whatever. So you're not gonna offend them if you ask questions, and if you offend them when you ask questions, come on, they're a grown adult, they'll get over it. But don't be afraid to get as informed as you can, because again, it's your treatment. You're allowed to get to know as much as you want. And if they act annoyed about you asking questions, give me their name, because again, it's your treatment, it's your body. You're allowed to want to know everything they're doing, because again, it's going into your person. It's only fair. So don't be afraid to ask questions. Seriously, do it. I bug all my doctors all the time. Do it. Number 4, this one's touchy and it can be terrifying, but don't be afraid to say no. If they come up with an idea and you don't like it, say it. If they say something that freaks you out, say no or ask for further explanation, because I've had surgeries where one doctor told me one thing and another resident told me something else, and the procedure that the resident described could have 100% given me an aneurysm and killed me. So if I would have just stayed silent, I would have gone into the operating room terrified, and I don't even want to go into that headspace. But I said, I'm not having surgery until you clarify this for me. I don't care if it pushes people's limits. I don't care if surgeries get pushed and times get messed up. I am not comfortable with this, and I am not having surgery until it is cleared up. Because again, I cannot say this enough, it is your body and it is your health care. You are not being selfish saying no. You are taking care of yourself, and when it is your body that you're supposed to take care of, you're allowed to say no. If you're uncomfortable, say it. If something feels off, say it. You'd rather say it and learn and get all the information or have the changes than not say it and have so much worry and or something flat out go wrong. So again, they might think you're annoying. Who gives a crap? They'll get over it. They're adults. If something feels wrong, say no. It's a 2-letter word, but so often we're too scared to say it because we're worried about what other people are going to think, and we're worried about hurting other people's feelings. No more. None of that. No. That stops now. If you're worried about something, say no. Do it. And if you're worried you won't be able to say it, practice it in the mirror. Seriously. Because doctors can be intimidating, and they can act like they know everything, including all of your medical stuff, which not true. So if you have concerns, say no. It can be a little thing, or it can save your life. But you'd rather say it than not say it. Seriously, just try it. No. That's number 4. So there you go. Those are my top 4 necessary must-dos for patient advocacy. They're not difficult, they're not complicated, but so often we forget one up to all of them. And when you have a chronic illness, or even if you have an illness pop out of nowhere, this stuff isn't taught in textbooks, and it doesn't come with a manual when you get sick. And your doctors won't tell you this because they're not interested in your advocacy, they're interested in treating the issue. So I've come to learn with all the surgeries and all the complications and all the procedures and stuff that this is very important, and it helps with your healthcare, because if you are not overly worried and you're not scared and you're not stressed out about all this stuff and all of these unanswered things, it helps you. Having less stress helps your body, and it can help heal you, or it can help keep your symptoms at lower levels and can decrease flares and all that stuff. So it's not just about asking questions and, if you have to, being annoying. It's about taking care of yourself. Do it. So there you have it, my must-haves for patient advocacy. If you guys could subscribe and share this with someone you know that goes to lots of doctor's appointments or has to deal a lot with medical professionals, that would mean the world. As always, thank you so much for even taking the time to stop by. It means the world and really blows my mind every single time. Yes, and take care of yourselves and stay safe, and thank you as always for coming, and stay tuned. More videos to come. Take care, guys. Bye.